It's officially been 2 months since I had lower jaw surgery to fix my underbite. So in this video, I'm gonna touch on the swelling that I still have, numbness, pain, energy, how I'm eating, exercising, and a lot more. Okay, so I had my 2-month check-in with my doctor earlier this week, and he removed like the 4 screws that I mentioned in my previous video, so they're gone. I have my normal teeth again and feels really good because like I told you I could feel them the whole time kind of sitting here. So now I'm like totally fine and they did not hurt at all. When I went in, I was a little nervous because I'm like, I kind of mentally prepped for how they were going to take it out. But I'm like, oh my God, it's gotta hurt. Like the screws are in my mouth. But they started off with like numbing it and then they injected some local anesthesia, I think. And so like by the time he actually took the screwdriver to my screws, I did not feel a thing. Really there with the screwdriver, like unscrewing those screws in your mouth. So very weird feeling. I didn't even feel it twist, honestly. So nothing. If you're going through this was one of my biggest concerns before I got lower jaw surgery. Do not let that stop you at all because I am here to tell you, you don't feel a thing. Truly. Afterward though, I did feel like a little bit of soreness. I mean, as you would just because like they were holes in your mouth. You can't really see the holes when you look in the mirror, like they're so small. But I did have to take like ibuprofen for a day or two just when I was feeling a bit achy. And then they told me to do saltwater rinses because it is an like open wound in your mouth. So I did that for a couple days as well. Now I'm about like 4 days since that appointment and I don't feel them at all. I stopped the rinses. I don't have to take ibuprofen anymore. I don't feel anything at all. I also don't have to wear my splint anymore officially, which is nice. I do wear them. So I have my ortho appointment next week to resume my Invisalign trays and like switching them out and stuff. So my doctor said in the meantime, during the day, if you can wear the splint, just wear it in between your meetings and stuff like that. I wear my Invisalign at night when I go to sleep. So I am still wearing it like here and there, but definitely not getting the same hours that I was before. Okay, so let's talk about swelling. I think I have like very minimal swelling right now. They would really be here if there were any swelling, but I do think my face still looks like rounder than it did before. There's no way that I'm completely healed because doctors actually say that swelling takes up to a year to like fully resolve. So I do think like there's some residual swelling here, but let me do a side view. Looking good. I really like my side profile now. And I smile and bite down. I really do like it. In my previous video, I talked about like under chin swelling that I still had. I was filming with my phone like on the table looking up. So it was also at a bad angle, but oh my gosh, it made me look like I had such bad like swelling or like a huge under like double chin right here. I'll insert some photos here that I took at the doctor's office of my before and after. So you'll see that like goblet, I like to call it, even before the surgery. So like that's obviously not gonna go away. But I do think like obviously, by cutting some of the bone off, there will be like some excess skin, but I do realize and I accept that like I already had a little bit of a goblet before. It won't go all the way down. I don't expect it to. Oh, also, I'm getting married in like 5 months. So that's the other thing that I was like kind of worried about in doing this jaw surgery. I knew I wanted it done as soon as possible, but just with getting my teeth into the good position before I could get the surgery, it just all worked out that like the surgery could only happen about like 7-8 months before my wedding. And so now that I'm past like the 2-month mark, I have exactly 5 months left until my wedding. And I'm really hoping and looking forward to seeing like the swelling continue to go down and see like how else my face is going to change. And I plan on making a video sometime in the future about wanting to get the jaw surgery partially because like I never liked the look of my underbite and wanting to change that and how it affected my confidence and stuff like that. But I am excited now that I have it fixed and, I'm crossing an important like life event, getting married and being excited to take pictures, whether that's like front facing or to the side, like that's all really exciting. And I'll keep you guys posted on how that goes. Okay, next I'm going to talk about numbness. And honestly, like at 2 months, I completely don't feel numb at all. I had really minimal numbness even coming out of the surgery. I told you guys that I probably had like 10-15% numbness on my lips and my chin right after the surgery, but it wasn't really noticeable to me. And that's something I was concerned about before doing the surgery because like a big risk of doing the surgery is that they could like hit a nerve or do something that would like paralyze your nerves, affecting like feeling in your lips or chin forever. And I know a lot of people even lose feeling in their chin, let's say, or like yeah, like some part of their lip for like the rest of their lives. Like maybe not full numbness, but just like a certain percent, like they can't feel it. But I will say, like, I'm lucky that I didn't experience that. And I did take B12 kind of starting around week 4 of my recovery as suggested by my surgeon. And so I'm still continuing to take the B12. Actually, I'm just trying to finish the bottle. As of 2 months, I'm completely feeling back to normal and I do not have any more numb spots. I think I did mention last time though that where I had the TADs, those were the areas that I felt numb, especially in my lower jaw. And after getting the TADs out, I don't feel numb anymore. Okay, in terms of the pain, sometimes like even just touching here, like how I did before, I do feel like a slight ache or a soreness, but it's not like painful. I will say last week during week 7, I had really bad like temple soreness, and I feel like that usually, so they said that like the muscle that connects your temples is connected to your lower jaw. So it makes sense that like my temples are feeling sore. But anytime I feel like I'm like talking more during recovery or I'm just like moving my lower jaw like a little bit more, that's when I feel like those are the days where my temple pain really like flares up. And so I had a really bad day last week in terms of temple pain, and I just took an ibuprofen to get that. Oh, I took an ibuprofen and also a muscle relaxant to get that to go away. I will say I think I feel a little bit like stiff sometimes. Let's say you have like food stuck in the back of your like teeth or your mouth and you use your tongue to like, scrape it all the way to the back. That motion, I wasn't really doing a ton of that when I was like recovering from surgery, just because like it feels really stiff to like move your mouth and your jaw when you're in recovery. And so this week, as I'm like starting to eat and stuff again, I'm like trying to go back to like everything that I did before. I don't know, yawn the same way that I used to, like just different things like that. And I do feel like my jaw is still a little bit stiff. So I think there's a bit of this like resuming your normal activities in more ways than one. Like it's just like so many random things. Ooh, and I got cleared to finally start chewing again this week during my 2-month appointment. And it's been so weird, you guys. Like I took a like vlog style video, which I'll post like next week or something like that, of taking my first bites again and how that feels. It's freaking weird. If I'm eating chicken or pork, like I'm not like tearing the meats yet. I'm just kind of softening it in my mouth because it feels really weird to chew still, and a little like achy or tender, I would say. It's not painful at all. It's just kind of weird, and I'm always like a little bit more cautious, I think, than not. And so I'm chewing really lightly on stuff. Yeah, I think it's going to take me a week or two to just like relearn where I'm supposed to be chewing food, biting down a little bit harder. But finally eating again. I'm so happy. I like ate chips on the first day because I'm like, I just missed the crunch of a chip so much, and it was glorious. In terms of like changes to my speech, I do think my like S's and T's sound a lot cleaner and like crisper. And that was something Max actually noticed like a few weeks after surgery when I was starting to talk a little bit more. I mean, my voice sounds the same, but like my pronunciation was a bit clearer. So I started like voice acting in the past year, and I did notice that when I was recording like auditions and stuff last year, my pronunciation on certain words would be either like muffled or just like a little bit unclear. And I did get that feedback from a casting director before, and I tried really hard to enunciate certain words, but it was just really difficult sometimes because of how fast you're talking sometimes and like how air escapes your teeth just with how your bite is aligned and stuff. I do think my pronunciation is clear, my diction is clear. So yeah, I'm really looking forward to seeing how this is going to like impact and improve my voice acting. I will say though, I think that my tongue is still getting used to where my jaw sits, because I think my tongue, like when you have an underbite, your tongue kind of like pushes forward a little bit where there's a gap in your teeth. And so like I think my tongue is still doing that. So I'm flubbing certain words when I like talk, or it just like sounds a bit like funny. So I think that there is a little bit of like relearning too and retraining your tongue placement. But yeah, like that was something that was interesting to me that I didn't know about. In terms of my energy levels, I'm feeling really good and like feeling totally back to normal. I'm so exhausted after being back at work for like 2 days. I think that's just like everything. I think that's starting chewing again this week. I got cleared to start exercising again. So I've started like getting into that like kind of slowly, talking for many hours, sitting in meetings, using my brain again, getting into the routine. Like I'm so exhausted after just 2 days of working, but I also think that like I was exhausted pre-surgery when I was working. So it's not really new there. I think that my energy levels are back to where they were before the surgery. And I've started working out very slowly, easing back into it because I feel like if I do like, I don't know, fast movements or something, I feel, I don't know how to say it. It's not numbness or soreness, but I do feel like a little balloon. Like, I don't know if that's a good way to mention it, but like I just feel like, a little bit of puffiness here. And so before I go back into like jumping and like intense exercise, I'm easing back into it by just like doing some weighted exercises, treadmill, going on hikes and stuff like that to get myself back into it. I am hoping to get back into like a HIIT class and more high intensity stuff in the next couple of weeks. And then I wanted to mention some stuff that like surprised me or some stuff that was unexpected. And I'll only go over like a couple points here, but I have so many, I thought I would do like a whole separate video of what surprised me. But one for me is that I actually did not have any weight loss. And that's funny to me because pre-surgery, I was reading online, even my doctor said that you might lose, 5 to 10 pounds. Some people don't eat at all, and that's why they lose that much weight. And I was kind of looking forward to it. I'm not going to lie. I mean, I got a wedding coming up. And I think maybe I was still consuming a lot of calories because I was just so hungry. So I think that I was still keeping up my caloric intake. And then when I switched over to soft foods, I was basically getting back to like regular foods, but just cutting everything up. And I think that my portions were a little bit smaller. But I don't know, like I just didn't experience the weight loss that other people had. But I don't know, like that was one thing that surprised me because I had absolutely no weight loss at all. And then the other thing that surprised me was that I didn't know that like the screws would be in for such a long time. Like I kind of thought that they would be in for 4 weeks or something like that, and then that they could come out. And like I only used them really for the first 10 days of like post surgery because that's when I had the bands on. And after that, like they weren't being used anymore. So I thought that they could come out, but like they stayed in there for a full 8 weeks. That's something I was surprised about. And then the other thing I also didn't know was that I would be wearing the splint for such a long time. I had asked pre-surgery if I would be getting a splint and they said yes. And so when I woke up from the surgery and didn't have the splint in, I was surprised then. I hear so many stories about people waking up with a splint in their mouth, so I was surprised that I didn't have it. And I was excited that I didn't have it, honestly, because like it did feel like normal, like, right? Like I didn't have a thing in my mouth. I got it during week 2 and I've had to wear it until week 8. So I was surprised that I like had to wear it for such a long time. And it was really, really uncomfortable to begin with because it was so tight. But by the end, it was totally fine. Like it was really easy to take on and off even now. And yeah, I didn't know what it looked like. I didn't know how to feel about it. But I was surprised by how long I had to wear it. And then in terms of like how I feel and my mindset and like my emotions about the surgery, like it's funny because now when I see like friends that I hadn't seen since pre-surgery, they all kind of like stare at me funny. And like some of them will tell me like, oh, you look the same. Like it doesn't look like anything changed. And some of them will say I look like slightly different, like there's like subtle differences that they see. And it's funny because like if you think about like what the right reaction to someone who's had surgery is, when people say I look the same, I'm like, hello, like I just went through major surgery. Like I don't want to look exactly the same. But then when people say, oh, you look totally different, or like, oh yeah, that's different, then you're like, oh great, well they noticed how like prominent my like underbite was before. But then like there's no good way to say it and no like good way to receive it, I guess. And so we all just kind of landed on like, you know what, like next time you just say like, it looks nice, like you look great. And you just got to accept it because sometimes people just like don't know what to say and they want to say what they think is going to make you feel good. Know that everyone just thinks you look great because you went through the surgery. You definitely look great. So yes, here is me at 2 months. I honestly can't believe that 8 weeks flew by so quickly. In the first 2 weeks, like that was probably the roughest time. Pretty much back to normal now, getting adjusted to my new bite. For any of you that are watching that are in the midst of recovery, in the early stages of recovery. It'll get better week by week. I promise, day by day, week by week, it's gonna get better. Keep yourself busy, do hobbies, go out for walks, see your friends, talk to people. Time will pass and you are actually going to miss time in recovery where it was nice and quiet and peaceful. Thank you guys so much for watching. I hope that if you're in recovery, you're also doing super well in your jaw surgery recovery. If you're in the early stages, hang in there. I know how difficult it was. If you look at my like 1 week post jaw surgery video, like that was freaking rough. So I know how that goes, and time is going to pass really quickly and you're going to be feeling like normal and so much better in no time. So thank you guys so much for watching. Leave your comments below. What are your like lingering concerns or thoughts after 2 months? And if you're watching this and you've already done the surgery and are further down on the road, let me know when you feel like your swelling completely went away, because I don't look swollen, but I'm sure that I still have a little bit of residual swelling, but I'm curious when that goes completely away. So thanks guys. Have a good day.